Good evening. I'm Psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now, in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios that lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. That's Matters of the Mind, all one word, at wfwa.org. And I'll start tonight's program with an email I recently received. It reads, "Dear Dr. Fawver, my mental health concerns have become more stressful lately and are impacting my daily life more than they have in a long time. It does cause myself and other loved ones stress. Here's the thing. To me, going to the doctor is also stressful for me. How can I get over it?" The issue becomes if the stress and irritability and anxiety evolves into insomnia. Often you have this cascade of stress leading to anxiety, which leads to insomnia, that leads to depression, and that becomes a health problem for you. So somehow, some way, it would be nice for you to use telehealth. It would be nice for you to see a primary care clinician who would be trusted for you to be able to help you at least have an accurate assessment on what's going on for you right now. Sure, counseling can always be helpful if you'd rather not see somebody in the medical field. So you could start with your pastor, you can start with a rabbi, priest, anybody with whom you have a religious affiliation. And sometimes people can simply refer you to local counselors that can be helpful for you. Because if you're just dealing with stress and putting up with stuff, you want to catch it before it cascades into severe anxiety, insomnia, and depression, because then you start having a lot of problems in a lot of different ways. So you can always talk to a counselor to be able to help you with that. So stress is something we all endure. Stress is basically a change in your life. And the problem with stress, we need to have stress. We need to have stress to literally keep us sharp. But when you have unmitigated stress that leads to difficulty with coping with it, and that difficulty with coping with it causes you to start to brood and ruminate and stay up at night, that's where it becomes a problem, and it can physically make you sick. I mean, people with chronic stress are more likely to develop diabetes, strokes, heart attacks. I mean, they can have more of a likelihood for obesity. So if you have anxiety that leads to insomnia and depression, that leads to a lot of medical problems that otherwise wouldn't be there. So keep an eye on how that goes for you. Let's go to our first caller. Hello, Sam. Welcome to Matters of the Mind. Sam, you want to know, is there an over-the-counter alternative to congestion medicine that when the congestion medicine says don't take if you're taking antidepressant medications? And what's the danger of over-the-counter medications for congestion with antidepressants? What's the drug interaction? There's a lot of different cold medications and there's a lot of different antidepressant medications. So the cold medications and antidepressants that are most concerning will be, for instance, dextromethorphan. That's the DM, which is a cough suppressant. It's been around for 65 years. But DM, dextromethorphan, has a mild serotonin effect, very mild, but it's enough sometimes to give you side effects if you're already taking a medication that affects serotonin, such as Zoloft, Paxil, Prozac, Lexapro, Celexa. These are all medications that predominantly increase serotonin. So if you increase the serotonin with dextromethorphan, a cough suppressant, on top of an SSRI, like I just mentioned, yeah, you can have some difficulty with fast heartbeats, sweatiness, headache, diarrhea, and have some side effects from the serotonin aspect. There are medications out there that have decongestion as oral medications, pseudoephedrine. These are kind of the medications that will give you vasoconstriction. In other words, they clamp down on the blood vessels and in doing so decrease the congestion. They should be used only for a short period of time, but those very medications can increase the blood pressure. And if you use them with a medication as an antidepressant that can also increase the blood pressure, that can be problematic. So those medications would be the serotonin norepinephrine reuptake inhibitors like Cymbalta, Prestique, Effexor, Fitzema. These are medications that increase serotonin and norepinephrine, and they can give you higher blood pressure. Wellbutrin, bupropion can also give you higher blood pressure with the oral decongestant medications. Whereas antihistamines out there, antihistamines in cold medicines will kind of help you sleep and decrease some of the congestion themselves, but the antihistamines can also make you tired if used with sedating medications such as mirtazapine, also known as Remeron, and the old tricyclic antidepressant medications. So it all comes down to looking at which particular medication you might be using for a cold medication and which one you'd be using as a medication for depression. Typically, if it has guanfacine in it, guanfacine loosens up the mucus. As a matter of fact, there's a brand name of guanfacine called Mucinex, so guanfacine would be fine with the antidepressant medications. But quite frankly, if you have congestion, nasal congestion, I learned from an ear, nose, and throat clinician a long time ago, the best thing to do is just simply use the old-fashioned neti pot. A neti pot is where you use basically a steam pot. Obviously, you don't want it too hot going up your nasal passages, but you want to moisturize your nasal passages by using distilled water in a steam pot that allows you to decrease the congestion. That's probably the best way to take care of it anyway. But if you do need to use medications, guanfacine is probably one of the better ones to use. Drink a lot of fluids with it because that helps loosen up the mucus that way. Thanks for your call. Let's go to our next caller. Hello, Yan. Welcome to Mayor's of Mind. Yan, you want to know, why does coffee or other stimulants sometimes have the opposite effect on your energy and alertness? Well, hear about coffee sometimes having the opposite effect for some people because they are just drinking a lot of coffee. So if you drink a lot of coffee, eventually it can just kind of backfire on you and make you kind of tired. What's a safe amount of coffee? 200 to 400 milligrams a day. So we're talking about maybe 2 double espressos a day. If you drink more than that, sometimes it can make you feel more tired because you might consume the coffee and within an hour or so you're crashing, and you might interpret that as the coffee making you tired when it's actually you're just rebounding so quickly. So that's causing you to feel tired in itself. Coffee does have caffeine in it. Caffeine will go to these little receptors in the brain and they will knock off adenosine from the receptors, and when adenosine is on the receptors, it makes you tired. So as you're going through the day, adenosine is kind of like the exhaust fumes in your brain. So as you're working your brain and you got all this energy going in your brain, you've heard of maybe ATP. Well, ATP goes to ADP. The A in ATP means adenosine. Adenosine fumes in the brain make you more and more tired as the day goes on. What caffeine will do is it knocks the adenosine off its receptors and will, for a while, help you feel less fatigued and more alert. So it can help you in a lot of different ways, but when you get over about 400 milligrams a day, it can sometimes not work so well because your brain gets used to it. So keep it at 400 milligrams or less of caffeine every day is going to be your ideal dosing, and it shouldn't cause you to become dependent on it. Higher doses can. If you feel fatigued after coffee, if you have a headache in between coffee consumption, that means you're probably getting a bit much. You want to back off of it just a little bit in those cases. Thanks for your call. Let's go to our next caller. Hello, Carla. Welcome to Mayor's the Mind. Carla, you were wondering about dissociative identity disorder. That used to be called multiple personality disorder. You'd mentioned it's often depicted negatively in the media, but can you discuss how it's a protective response from childhood? It is a protective response, but it's not considered to be a healthy protective response, Carla. So what happens in childhood if somebody's been traumatized, and it occurs for whatever reason, more commonly with women than men. If you've been traumatized repeatedly in childhood, what happens, your brain kind of goes off and zones out. And that's the dissociation part of it. Dissociation means you're detaching yourself from reality. So you kind of become, well, the lamp. You just become something else as you endure the trauma. And it's called dissociative conditions when that occurs. Dissociative identity disorder is where, as a coping mechanism, as you go through your adult life, if you have any kind of stressful situation, your brain, unfortunately, inadvertently will short circuit, and it's kind of like an electrical short circuit where it short circuits into dissociative identity, where you become a personality for a matter of seconds, minutes, or sometimes a couple hours, but you become a different personality that might be empowered, might be more childlike. It's a different personality, and during that time, typically people will forget they went into that personality. People with dissociative identity disorder will often have spells where they just lose track of time, and they're in one room for a while, and then all of a sudden, a few seconds, a few minutes go by, they're in another room, and they have no idea how they got there. It might have been something as simple as their coworkers or their bosses raising their voice toward them. Something very simple might have set them off into that dissociation. So it is a means of the brain protecting itself from the trauma, because your brain's trying to forget the trauma and go off into a different place while it's occurring. But it's a poor means of the brain coping later on, because obviously dissociative identity is not productive in your day-to-day life. Thanks for your call. Let's go to our next email question. We have another email. Here it goes. It says, Dear Dr. Fawver, what's the difference between Prozac and Zoloft? Those are two very old serotonin medications. I mentioned both of them earlier. They're serotonin reuptake inhibitors. Prozac and Zoloft have been out for several decades. Prozac, or also known as fluoxetine, came out in 1987. Zoloft came out also known as sertraline, came out in 1992, I believe. So they came out years ago. And there was a subtle difference between the two of them. Prozac has more drug interactions. Zoloft had fewer drug interactions. That was one of the issues. Prozac or fluoxetine typically would cause people to have more weight loss. It affects the serotonin 2C receptor in a different way, as does Zoloft. Sertraline or Zoloft will also enhance a little bit dopamine. So they work subtly differently, and that's why some people will say they did better on one versus another. However, I would discourage people from going from one serotonin reuptake inhibitor to another. We ask everybody, what medications have you previously tried? What do you remember about them? If somebody's been on Prozac, we've got a lot of options now from which to choose, where we can put them on a different antidepressant. But you could try Zoloft, especially if they have a lot of anxiety that's still there. Zoloft is better for anxiety for a lot of people compared to Prozac. But we typically don't want to see people going from Prozac to Zoloft to Celexa to Lexapro to Paxil to Luvox. Those are all medications that have a lot of similar mechanisms of action. And we have so many different antidepressants from which to choose that it's often nice to go to a different class overall. Thanks for your call. Let's go to our next caller. Hello, Mary. Welcome to Mayor's the Mind. Mary, you said you've been taking Paxil for depression. What are the side effects of Paxil? And are they different for women than men with the side effects? Paxil is a medication, came out in 1994. 2 years after Zoloft. So Paxil, also known as paroxetine, is stronger as a serotonin reuptake inhibitor. In other words, it's more potent on serotonin, and for that reason will give people more of a calming effect. And for many people, that's not pleasant. They will feel more sedated, more calm. The issue with Paxil or paroxetine is it inhibits its own metabolism. And what that means practically is if you stop it, the inhibiting of its own metabolism is no longer there, so the blood levels will plummet. So when people miss a dosage or stop Paxil or paroxetine abruptly, they'll have withdrawal symptoms, discontinuation symptoms, such as zings and zaps in their hands and feet. They'll have a burning sensation in their head. They'll feel dizzy, and it can be very, very unpleasant. So Paxil or paroxetine is most problematic from an adverse events standpoint in stopping or missing a dosage. Otherwise, compared to other medications in that class that affect serotonin, paroxetine or Paxil is more likely to cause you weight gain. So sedation and weight gain are the main side effects from it. A little bit of dry mouth for some people. And it's because it's so potent on serotonin, it can give you more serotonin toxicity, where people will have more serotonin-related side effects, such as restlessness, diarrhea, headache, palpitations sometimes. They might notice getting more of a punch of serotonin effects from paroxetine or Paxil. But it is used extensively for panic attacks, post-traumatic stress disorder. It can be used at low doses for menopausal related symptoms. So it's used for a lot of different purposes, but you want to be very cautious in using it. And if you're using Paxil or paroxetine, you want to make sure to take the dosage about the same time every day. Because if you miss a dosage for about 6 or 8 hours, sometimes you can get those discontinuation symptoms that can be quite unpleasant. Thanks for your call. Let's go to the next caller. Hello, Grace. Welcome to Mayor's the Mind. Grace, you had mentioned that you're recovering from pneumonia and you've been experiencing brain fog. How does physical illness affect your mental health and memory, and can it trigger mental illness? Not so much it'll trigger mental illness, Grace, but mental illness in general is where you're experiencing depression, anxiety, difficulty with concentration, keeping in touch with reality, mood swings, and it gives you significant functional impairment where you're having trouble on the job, with the family, and getting the things done you want to do. You're noticing brain fog from pneumonia, and what happens there, Grace, is when you have pneumonia, you'll have this release of various inflammatory proteins such as tumor necrosis factor. You'll have interleukin-6. These are different proteins that are inflammatory proteins. They go to the brain, and when they go to the brain, inflammation of the brain can be manifested by brain fog, difficulty with enjoying things, fatigue, and difficulty with motivation. So when you have these inflammatory proteins going to the brain, you can have those kind of symptoms. Do they go away after a period of time? Typically they do, but some people will notice that they need something to kind of offset the brain fog, and we'll sometimes treat them with specific medications if they're having those kind of problems. But brain fog is related to inflammation. Inflammation can occur from pneumonia. We heard a lot about this, Grace, when people were enduring the COVID-19 infections. Many people had brain fog. They had mood swings. They had all sorts of things happening following a COVID-19 infection, and sometimes it'll be persistent. If they have more irritability and moodiness, we'd often treat them with a medication like lamotrigine or Lamictal. If they had more difficulty with brain fog, the main medications we would use would be Trintellix, also known as vortioxetine. Once in a while, bupropion, also known as Wellbutrin. Sometimes we'd use Auvelity, which has been out for the past 4 years now. But these are the kind of medications we're using to decrease the inflammation that can be related to brain fog. Thanks for your call. Let's go to our next caller. Hello, Tom. Welcome to Matters of the Mind. Tom, did you have a question? Tom, you want to know about the treatment plan for OCD and hoarding. OCD and hoarding are entirely different phenomena, Tom. OCD is a condition where you will notice that you have difficulties with thoughts that don't make any sense to you, that go round and round and round your head. And they're annoying, and you don't want them to have there. They don't make any sense. So OCD, obsessions with OCD, are not simple brooding and worrying about things. They're thoughts that don't make any sense to you concerning contamination, counting, things that just don't make any sense to you. And what happens from a neurobiological standpoint will be that those thoughts are going around and around and around in this front part of the brain, and they get stuck. And when they get stuck, you can't get them off your mind. And sometimes you will then follow through with compulsions. Compulsions are where you start counting or you do things very methodically to try to get the thoughts off your head to try to give you some relief. So for instance, if people are very concerned about contamination, they might wash their hands over and over and over again to the point where they have their skin sloughing off their hands. I mean, they get terrible skin conditions because they're washing their hands so much. This is because they had the thoughts of contamination. So obsessions can lead to contamination. That's OCD. That circuitry, to knock that kind of off the circuit, can be alleviated from a medication standpoint by either having some simple talk therapy where people are told to think or at least say out loud very quietly the word stop as a means of stopping the round and around circuitry. It sounds like a very simple behavioral technique, but that's a technique that can be used. But from a medication standpoint, we use high doses of the serotonin medications, which I've discussed on several occasions tonight. The high doses of serotonin medications tend to calm this excessive circuitry, and it's like the old record players where the needle's getting stuck. The high doses of serotonin medications tend to alleviate much of that. I've seen OCD occurring predominantly after people have had a strep infection, like they have a really bad sore throat as children. When you have a bad sore throat as a child, it can inadvertently, the antibodies for the strep will inadvertently attack the front part of the brain. And when the front part of the brain gets attacked, it can throw you into the circuitry. So even later on, with a delayed response, you can have OCD occurring as an adult if you had recurrent strep infections as a child. I've seen OCD occur not uncommonly when women have babies. So when you deliver a baby, you're going to have the mother bear instincts and you're going to want to protect your baby and keep things clean. But I've seen some women have that mother bear instinct where they start cleaning excessively and it becomes a problem. And they know they're cleaning excessively. And that's the key with OCD. Most people have good insight and they're aware that they're doing things excessively, but they just have a hard time stopping. What do they do when they try to stop the compulsions or stop the thoughts? They get more anxious, and that will cause them sometimes to think about it more. Hoarding, entirely different phenomenon. Hoarding is where you're keeping things unnecessarily, and hoarding is less understood, but it used to be thought to be part of OCD. It's entirely different, even in terms of the brain circuitry. With hoarding, it's more of a sense of your own identity. When you get rid of things that you might have acquired over the course of time, you look at those as part of your own possessions, and when you get rid of them, you feel like you're getting rid of some of yourself. Or if there are important aspects of something from family or friends, something that you've been given, you just have a hard time getting rid of it. And that could be something as simple as a magazine or something where you perceive that if you get rid of it, you're going to lose a part of yourself. So hoarding is not something that's medicinally treated. It's something that people are going to try to treat from a counseling standpoint to try to help them piece by piece by piece declutter what they actually don't need and give them some reassurance that in getting rid of those things, they'll still have their own self-identity. Thanks for your call. Let's go to the next caller. Hello, Seth. Welcome to Matters of the Mind. Seth, you want to know, where do thoughts come from? Thoughts come from the front part of your brain. Now, to articulate a thought, you have to think about words, all right? So the front part of your brain is where your thoughts are gathered. So your thoughts are gathered by words. That's why you don't have your initial memories until you've been able to articulate words until you're about 3 years old. Now, some people will insist they can remember things when they were infants or toddlers, and that's okay, but usually your thoughts are not downloaded until you can form words. When you form words, those are thoughts. So if you think back to what you had for a meal earlier today, breakfast, lunch, or whatever, you think about it, okay, you start articulating the words of the foods of what you had. Okay, those are how your thoughts are made. And it's important from a neurobiological standpoint because some people will hear thoughts in their head, and those thoughts are considered to be auditory hallucinations. Those thoughts are as loud as a voice as my voice is for you right now. So when that happens, you have the thoughts forming in the front part of the brain. You have this little band of tissue called the arcuate fasciculus going back to the hearing part of the brain, and the yellow part here. And the hearing part of the brain, actually, if that arcuate fasciculus is impaired, you start hearing your own thoughts, and that comes across for some people as auditory hallucinations, where they can actually hear voices talking to them. What they don't realize, those are thoughts. They could be different voices, men, women voices, but what they are experiencing is they're actually hearing their own thoughts. It's because they have an impairment of the arcuate fasciculus going from the front part of the brain to the hearing part of the brain. Now, usually that arcuate fasciculus tells you, oh, I'm just thinking a thought right now. I'm not hearing it. But when you start hearing your thoughts, it comes across as sometimes very frightening for people, and sometimes those thoughts can instruct you and command you to do things you ordinarily wouldn't do. Those are obsessions occurring in your front part of your brain, as I mentioned before. Obsessions are often unwanted thoughts, and they go to the hearing part of the brain when you have a condition like schizophrenia, and it's because of the impairment of the arcuate fasciculus. Thanks for your call. Let's go to our next caller. Hello, Carrie. Welcome to Matters of the Mind. Carrie, you're mentioning you're having intense nightmares where you feel unsafe and it leaves you with a lot of anxiety during the day. Why is that happening and how do you stop it? Well, number one, Carrie, make sure you're getting good sleep hygiene the best you can. It might be even scary to go to sleep because of the nightmares, but when you can go to sleep at the same time every night, try to get up the same time every morning, that regular habit of your sleep hygiene and your circadian rhythm really will help. You'll have typically more dream sleep, which is the phase of sleep in which nightmares are accompanying, but increased dream sleep will often be there because you're having sleep debt and you're not getting enough sleep. So try to get enough sleep, try to get bed at the same time every night, try to get the same time every morning. That's the first thing you can do. Secondly, try to exercise first thing in the morning. Exercise on a regular basis will give you a greater depth of sleep at nighttime. So exercising can give you a greater depth of sleep at nighttime. Dream sleep is where the REM sleep, rapid eye movement sleep, and that's where the nightmare is originating. When you're in dream sleep, this left front part of your brain especially, called the dorsolateral prefrontal cortex, dream sleep is letting that part of the brain rest. That part of the brain is where you use logic and rational thinking. It's shutting down at nighttime. When it shuts down at nighttime, that's why your dreams might be abstract and you don't make a lot of sense. And that's okay, because your logical part of the brain is resting while you're dreaming. What you're experiencing will be nightmares, which is a combination of the resting of the dorsolateral prefrontal cortex and a firing up of your anxiety center, which is coming from the brain stem, giving you norepinephrine. So there's medications that we use, such as guanfacine, prazosin. These are medications that we'll use that affect norepinephrine receptors in a specific way that they can shut down the nightmares that people are occurring. Many people have nightmares when they've experienced traumatic experiences in the past. That's called post-traumatic stress disorder in some cases, but it's not diagnostic. Having nightmares will not be diagnostic that you have experienced bad traumatic events in the past. But nightmares can occur because of lack of sleep hygiene. I've seen nightmares occur with some people when they take a so-called beta blocker, propranolol, atenolol, metoprolol. These are medications that will shut down norepinephrine in the front part of the brain and sometimes do so excessively where people will have nightmares as a side effect. So I want to take a look at your medications if you're still having nightmares for whatever reason, because sometimes medications will make some of that worse. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.